Welcome back, everyone. It is Wellness Wednesday. That means GI Physicians back with us today. We have Denise and Cindy with us today. Last time we talked about diarrhea, all the many things, good Lord, that can cause the problem. Today we were talking too about medications that can cause that issue, right?
Yes, and good morning. Thank you for having us back again today. There are many medications that can cause diarrhea. Some of the most common, like antacids with magnesium and other osmotic materials in them. Laxatives, especially over-the-counter ones, because they contain senna, aloe vera, and some herbal supplements in them. These, with long-term use, can cause what's called melanosis coli. That's when the bowels do not react to the medications anymore. Metformin is a type 2 diabetic medication, also can cause diarrhea. And then some antibiotics, especially penicillins, because of two mechanisms of actions that they can cause. One is they're getting rid of the good bacteria, and two, they're allowing for the growth of bad bacteria called C. diff. And then chemotherapy drugs, cholesterol-lowering agents, thyroid hormones, and colchicine. And then radiation therapy for prostate cancer or any abdominal cancers can cause intestines, complications within the intestines, and then cause diarrhea.
Wow, all kinds of causes medication-wise. We talked last time about acute and chronic. When do we go see the doctor? When do we know something's not quite right here?
So some of the warning signs that you would want to call your provider, especially if you're already established with us, you could call us. We get patients in very quickly, but some things can be managed over the phone as far as ordering testing and that kind of thing. But if you have severe bloating, you're starting to have multiple episodes of diarrhea a day, urgency, nausea and vomiting, that can lead to dehydration. You're already losing fluid, then you have nausea, vomiting. You know, we don't want someone to get dehydrated and have severe complications from that. If you have that right lower quadrant pain, like I talked about, because you know, can mimic appendicitis and Crohn's disease, could be infection, could be one of those two things. If you have the increased stools and you call us and we see you, then a lot of times there's testing that we will do. We like to rule out things such as gluten allergy or celiac disease. Okay. 1 in 150 people we find with that. We also look for lactose intolerance. Some people will tell us, you know, their symptoms are worse after specific foods. Also, we will get a history. We'll see what surgical history you've had. Some people have had gastric bypass. That decreases the absorption. That can lead to even like a short gut type syndrome. Like we talked about with the gallbladder usually holds that bile. You've removed the gallbladder, now there's increased bile in the intestines. That increases the watery diarrhea. There's rare tumors that can cause increased diarrhea because they produce hormones that can cause diarrhea, such as lung cancers and carcinoid tumors. Irritable bowel, we talked about that. Yeah. Sometimes people are more nervous. You can have more irritable bowel with those type of things, and you can have irritable bowel with diarrhea or constipation. Procedures that would be done, including a colonoscopy, would look for inflammatory bowel disease such as Crohn's or ulcerative colitis, also microscopic colitis. Those things need medical management to try to keep them well controlled so that they don't end up leading to a colon cancer. We also had on our website, Dr. Cottapalli has a paper that he had published. He had a 38-year-old patient that had Crohn's disease, and she had had multiple complications, had surgeries, had an ileostomy bag. She was putting out 5 liters of fluid in her bag daily. Wow. So she was getting dehydrated, she was going into renal failure. She was found to have Cryptosporidium. Okay. And that was treated, but she still had the symptoms. So he actually found that she had post-infectious inflammatory diarrhea. Once that was treated, then her symptoms resolved. So just different things like that. We may even see that with post-COVID, because some people have had some GI symptoms with that, and they may have some lingering diarrhea. So there's all kinds of different testing that we can do with labs, stools, and then of course like colonoscopy type things with biopsies.
What a success story that was. So we know there's treatment available. What's some of that?
Well, Jeff, diarrhea is not a solid joke. But if the case is...
Her jokes are also love them.
But if the case is mild, people may not need to take anything for it. Or adults can take something over the counter like Pepto-Bismol or loperamide to help with the diarrhea. They come in liquids and in tablet form. We always say drink plenty of fluids, greater than 8 cups a day or greater than 64 fluid ounces to help keep hydrated. Drinking electrolyte replacement drinks without caffeine, tea with honey in it, chicken broth, and then some sports drinks are good choices to help with that. And then taking probiotics daily helps with bloating, gas, abdominal pain, and diarrhea. And then taking probiotics can help the body regain or maintain a healthy community of microorganisms. And just like Denise has said, call us, the GI providers, if diarrhea becomes a concern, occurring more than 3 times a day and lasting more than 4 weeks, for a workup, and then also for other diarrhea treatment options.
All right, help is available. I know you guys can help out. Thank you so much.
Thanks.
Tell us about it. We appreciate it. It's good seeing you. Don't go. We'll be back after this.